Hey everybody, it's Dr. Dave, Psychiatry. Thanks for coming to the YouTube channel today. Once again, reminding you that if medication fixes your problem, that makes it a medical problem, not a mental problem. That's the mantra of the channel. Once you lock that in, you can share that with anybody who cares, because that's how you should think about it. Getting glasses doesn't mean that you're mental. Getting glasses means you correct the vision in your eyeball by bending light. Taking insulin for diabetes doesn't mean that you have a personality problem with sugar. It means that you need more insulin. So that's how I try to start every video. Today I am going to answer a question that was asked of me by a commenter. It's pretty simple. It's a question I get asked all the time. So I thought I'd go ahead and just do a video on it and answer that question. The question is, does response to medication run in families? The answer is yes. In my opinion, the answer is yes. Is there scientific backing for that? Probably not something that I would go into here clearly, but in my training, obviously, there was a lot of understanding that that was likely the case. So in my practice, what I've always done is explored that possibility, and what I have found is that over time, it's really been proven to me true in clinical practice that for example, if your brother does well on Zoloft, you're more likely to do well on Zoloft. If your dad did well on Prozac, you're more likely to do well on Prozac than some of the others. And when I say more likely, I guess I have to be a little careful. In an individual, you don't really know. But the way I use the information is this. When I meet somebody for the first time, among the things you do when you do a first-time medical visit, you ask about your past medical history, your history of treatment, the medicines you've taken. And one of the questions I ask is about family. And when I was in training, honestly, it went so far sometimes that people would draw family trees. We were taught how to draw family trees, generational stuff, and to be able to explain, my uncle had this medical problem, that medical problem, etc. Today in my office, it's really not necessary to go that far. I ask very simply, do any of your first-degree relatives have anything like this that you know of? So by first-degree relatives, I then clarify mother, father, brother, sister. So I'm really looking for your closest genetic relationships, either above you or below you. And if you have somebody that above you, that is to say your mother or your father, has something that is like this, and if that person responded to medication, I simply want to know what the medicine is. So if you say, yes, my mother did really good on Zoloft, then I am much more likely, if you need a serotonin booster, obviously, I don't want to just give you that for no reason, but if you have a serotonin shortage, if you're here and you need to be here with your serotonin, then I'm more likely to start with Zoloft because of your mom than I would start with Prozac, Zoloft, Prozac, Effexor, Cymbalta. I would preferentially start with that because of your family history. If your dad did well on Xanax, if you need a GABA booster, if your GABA's low, you need that boosted, and your dad did good on Xanax, I would pick Xanax for you as my first choice over Klonopin or Valium as the first thing I would try. Similarly with kids, if you've got a kid who does well on Ritalin, and you come to me and you say, listen, I really discovered I had the ADHD symptoms because of my child, and I saw that I really focusing, paying attention, concentrating, staying on task, stopping things before I finish them, having lots of disarray in my life, not being able to just pay attention and focus. If I discovered those were problems for me, my child, my son, has the same problems. He did really well with Adderall. Well, I'm more likely, as your norepinephrine booster, if that's your medical problem, if you're low in norepinephrine, I'm more likely to go with Adderall for him. If you said, my daughter has those symptoms and she responds well to Ritalin and not Adderall, I would be more likely to try Ritalin first. Now, does that mean that I would not use Prozac in your mom or Zoloft in your dad because of your dad? No, you might respond in a way that's not genetically related. But if you're in the troubleshooting method, if you're looking for your first clue, well, I should say that's a clue. Your first thing you're trying to establish is, where are you with your serotonin, norepinephrine, GABA, dopamine? Those are the big four that we work with here, and how I think about in my office. But once you decide you're here or you're here or you're here or you're here, where you're going to start is sort of what's the biggest fire that you want to put out first. But then when you're picking the medicine, or if you have a genetic clue, I always use it. I always use the genetic clue. Now, does that make it right? No. But what have I seen over time? Over doing this for over 30 years? Yes. It really is true that if you have a direct genetic relative who does well with the medicine, and if you have the same type of medical problem that they have, you are more likely to do well with the medicine that they took than another. It's not always true, but I would say certainly more likely. And if I'm making the choice, I'm going to lean on that information heavily. Now, if you're a clinician and you're watching this video, then you could say, okay, good. That's a clue I hadn't thought of before. Nobody told me that before. So sure, family history is important. I don't need to know that my great-grandfather was a blacksmith. I simply need to know if my mom did good on a name brand medicine, or if my dad did good on a brand name medicine, or my sister did good on a brand name medicine, or my brother did good on a brand name medicine. Because if I know that, I'm more likely to lead on that brand name medicine, which obviously extends to generics. And now that we call Zoloft, we call it sertraline. But the point is that that was something that specifically worked for them. If you're not a clinician, if you're a person, you know the information I'm looking for. And if you watch this video prior to seeing me or prior to seeing the person you are going to go see, you can advance study that question. Many people come to me, and when I ask that question, they say, I didn't really ask. I mean, I could have asked, but I didn't ask. I didn't know it was important. So as a patient, if you're going to go see your doctor and ask for help, if you lead with, yeah, gosh, I just asked my brother what he takes, and my brother takes Paxil. He does great on Paxil. Then hey, guess what? If you've got the picture of serotonin shortage, very likely that I would suggest that you think about taking that first, and you can ask for it. You can say, look, I know this about my family. Here's the information that I can give you. That helps us make a better decision. And it's when I have a patient in the office and I ask them that question, the first thing they say is, well, can I call my dad? I'm like, well, we're sort of in the middle of this. If you can talk to your dad later. We're going to start with what we have today. And sure, bring me back the first degree relative information, what your dad took or what your mom took or your brother or your sister. But if you have it in advance, you can bring that to the person who's trying to help you, and they can use that as a clue. So yes, in fact, genetic information, not detailed family trees, but very simply, do you know anybody who responds well to a medicine that you know the name of that medicine? If you can provide that information to the person that you're working with, that is likely to help them make that first decision and hopefully speed you to the path of, not having, one failure here and then two failures here and three failures here, but finally getting to the point where, I finally figured out what it was. Well, if you know what it is from the beginning, if you know that's Prozac or Paxil or Effexor or Cymbalta, if you know the name of the medicine that helped that person that's closely related to you, whether it's above you, lateral to you, or beneath you with your kids, that information is useful, and I hope that you can transmit it to the person who's trying to help you, and I hope it helps speed your improvement of getting your brain chemistry to where it needs to be, which is a medical solution, not a mental solution. Okay, so I'm Dr. Dave Psychiatry. Thanks for coming to see me today.